A deep breath with ease. A short stroll with his wife. Thinking about these kinds of moments helped Fred Reyes survive a brutal 66-day-long hospital stay.
He was one of the sickest patients on the COVID ICU floor and had been there the longest. He almost died 3 times.
As he fought for his life, his wife Sharon wasn't allowed to see him for the first 6 weeks because of COVID restrictions. The hospital finally changed its visitation policy, and Sharon was allowed to stand outside his room looking in through a window.
It was quite emotional. I still get choked up thinking about it because I felt privileged. I really did. And I still do. I feel blessed and privileged and just so grateful for having a second chance.
Reyes says seeing his wife made his journey less confusing and credits her presence and later her touch with helping in his recovery.
It was important to be brought back to reality daily.
Virginia and Tom Stevens' COVID experience was traumatic at first. When the 88-year-olds had to be hospitalized, they were originally placed in separate rooms.
They found my dad wandering the halls, and he was looking for my mom.
Their medical team at Vanderbilt Hospital brought the couple together. They see it as the start of their long and slow recovery.
When we finally were united together in the hospital, we just shouted hallelujah.
I firmly believe that the family and the loved ones at the bedside are helping these people to physically heal.
Dr. Wes Ely is writing a book about humanizing critical care, and he wants more hospitals to find ways to safely bring patients together with loved ones.
This harm that people are experiencing in the hospital has definitely not been limited to the virus itself. It's also emotional harm.
Oh, you got it. Kathy Henderson is still processing losing both parents to COVID. They were married for 61 years and admitted to different hospitals at first, but she was able to convince the care teams involved that her mom Mary and dad Philip should be reunited, if only for a brief moment.
She was rubbing his hand saying, "Phil Hill, I'm here."
2 days after they held hands, both died, just hours apart.
Grief comes in waves. You know, you think you're doing good, and then you hear a song or, smell a smell, or somebody will say something and it'll knock you down again.
Henderson doesn't think the visit did anything to help her parents medically, but she's relieved it happened.
From a personal standpoint, from a human relational standpoint, it made a huge difference.
Preserving memories is Henderson's focus now, and she takes comfort in knowing her parents had one final goodbye. As doctors study human connections and recoveries, they may just very well find it also helps survivors as they try to go on. Katie Simpson, CBC News, Washington.